Thank you, Mr. Speaker, and it's good to see my colleague from New Jersey in the chair, and I want to thank Chairwoman Lowy. She's my classmate. Aren't too many of us left, but it's good to see you there. Thank you. I rise in support of H.R. 4378, the Continuing Appropriations Act 2020 and the Health Extenders Act of 2019. I'm particularly pleased that H.R. 4378 includes a provision that will increase enrollment numbers for the 9/11 World Trade Center Health Program, which provides health care and treatment for responders and survivors. Since being notified 2 weeks ago that this program is approaching enrollment capacity, I've been working with my colleagues in the House and the Senate, as well as the administration, to come to an agreement to raise the enrollment cap in order to guarantee that new enrollees will continue to have access to treatment. And so we were able to quickly come together on an agreement so that new enrollees will access this program for many years to come. The bill, H.R. 3778, also includes temporary funding extensions for several Medicare extenders and public health programs, including funding for community health centers, Medicaid funding for Puerto Rico and the U.S. territories, and the demonstration program for certified community behavioral health clinics. This temporary patch will protect Americans' access to these vital programs while Congress works towards a long-term agreement. And while I'm relieved that this bill will prevent any interruption of health care services, I want to stress that our work is far from done. We have to continue to work towards a bipartisan, long-term extension that provides funding capacity for these programs for the millions of Americans that depend on it. Now, the Energy and Commerce Committee has already voted in support of bipartisan, long-term extensions of these programs, and I'm hopeful that we can reach a bipartisan, bicameral agreement to get these extensions signed into law before this short-term patch expires in November. But again, I want to thank Chairwoman Lowy. I know you and Jerry Nadler, Carolyn Maloney, the New York representatives are very concerned about the health care. There's a DROGA Act for, in the aftermath of 9/11. So I particularly appreciate your support on that and yield back to the Chairwoman.